collectively. When it happens in someone unprovoked, there is no baseline cause. We can't say perhaps like a child has a convulsion as a result of fever. Are you getting it? We can't say those things are there, but the person was just having it repeatedly. Then we can say this person is living with a condition known as epilepsy. If you have seen them before, like for example, I will sit down and find it difficult to control my hand. I will just continue to swing it, and you look at me, it's not as if I'm happy doing it. I will even be scared. I'll be crying that I want to stop and I wouldn't be able to stop, and I'm conscious. So not all seizures will people lose their consciousness. The same way, not all seizures happen equally. It has to do with the part of your brain that is affected.
Talking about oxygen deprivation at birth, it's what we call perinatal asphyxia. So that's where that first cry, when a baby is delivered, that's why we're so particular about that first cry the baby makes after delivery. Because that cry is how oxygen is being transferred to the brain and then to the other parts of the body. So if there is deprivation of oxygen at that delivery, when the child is born, there could be some damage to the brain. And this deprivation, the extent of the injury, is dependent on how long the brain is deprived of oxygen. So there are some, we have the mild, we have the moderate, and then we have the severe form of this perinatal asphyxia. We call it HIE, that's hypoxic ischemic encephalopathy. So depending on how severe this deprivation is, then we can now be talking about how much damage is made to the brain. If the deprivation is just mild and the baby recovers fast, then the brain might just be fine after that, and the child might not have any other complications afterwards. But when we have the moderate, even from the time you are seeing that baby and the long time of deprivation, the baby might start having seizure right from that time, and it can extend to later on in life, whereby you now need to place the child on some medication to prevent seizures, and then eventually epilepsy. Then, if it's severe, that one can affect a lot part of the brain, and can have lots of them coming down with what we call cerebral palsy, which seizure and epilepsy is also a symptom of cerebral palsy in some children. So that is why we say that for delivery, when a child is being born, there should be healthcare attendants that are efficient in neonatal resuscitation. In case that baby, most of the babies will be born crying, some will have challenges crying and then deprivation of oxygen. And when there is no attendant that knows how to resuscitate that baby immediately, 4 minutes is all that you have. We even say the first 1 minute, you are already running out of time. Then when that brain is deprived of oxygen for 4 minutes, then the damage starts to occur. So we need people that are very efficient in resuscitating babies when babies are born.
I'm not a medical practitioner, neither am I a herbalist. But the truth remains, which is acceptable in such settings. She was born at a period the hospitals were on strike. And the important of not now, we had few specialists. So the contact we made was to home services. And the mother had a prolonged labor. It comes and ceases. So within that period, in fact, we were all on the road, moving from one home to the other. Until luckily, they called off the strike. In fact, one of the doctors who we were meeting had an Egyptian wife who was equally attending to the mother. And immediately they called off the strike. Her issue was the first to be handled in the theater. Unfortunately, we lost the other child because they were twins. They were yes. Yes. So we lost her, and that was how life started.
So let me start with a story. The year was 2006. I was in a clinic in psychiatric hospital Yaba. There were about 30 people waiting to see me. They were all on benches. There was somebody in the consulting room with me. And suddenly, I started hearing a commotion and everybody started shouting, "Leave her, leave her, leave her, leave her, run, run, run." And it was a lot of struggle. So I just felt psychiatric patients, anything can happen at any time. But the noise became worse, and then I heard someone grunting. So I left the person I was seeing and I went out and I saw the young lady having a convulsive fit, a seizure, right in front of my consulting room. Two things struck me. People who were dealing with mental illnesses that I think, in my opinion, are more severe than epilepsy ran away. And it is because of the fact that culturally, growing up, we heard, because I'm Yoruba, there was a word called warapa. And warapa is the Yoruba term for epilepsy. And what we were told was that people who got warapa were bitten by lizards, and that if you touched their saliva, because some of them would foam from the mouth, you would contact warapa. That was the reason why people who were dealing with schizophrenia and major problems ran, because they could not touch that person. So I came out, and of course I told them, "Look, just leave her, put her to her left side." And after 2 minutes, she was up and was like, "Oh, it had happened." Now that young lady is now a mother of 2, and I still see her from time to time. So basically, that's just to show you how severe the stigma that is associated with epilepsy is. And for me, it comes from 3 things. One, like I said, is culture. Culture is more, culture is stronger than logic and knowledge, because even people that are supposed to be professionals would still have issues with. So for instance, I tell someone, "Oh, there's a history of depression in your family. Would you allow a member of your family marry someone with depression?" And they're like, "God forbid." I'm like, wow. But you have depression in your family. And if the other person decided to investigate your family, they would say, "Oh, there's a history of mental illness in yours." And you're like, "Oh, no problem, just hide it and just not let anybody know." And so it's a lot of culture, and that has to change. And then there's also a lot of ignorance, because yes, we have things like this that are very good to advocate and help people understand, but I can't count on fingers how many people have seen anything on epilepsy on TV in the last 1 year. I've not seen it, and that's true. Growing up, I actually had, if you've ever watched the movie Cleopatra, Julius Caesar had seizures, and in the movie he had a seizure, right? And so that was the first time I ever saw it, and I'm like, "What's that? What happened to him?" And for me, that is how we counter the ignorance thing. And then, of course, there's also the issue of there are other problems which we're going to talk about that are associated with epilepsy. And so quite a number of my patients who have convulsions and have epilepsy see me because of the other problems that come as a result of it. The stigma, the fact that they are ostracized, the fact that people actually lose school positions. So while I was also in Yaba doing residency, I think I was a senior registrar then, so it was like 2008, 2009. I had a patient of mine get kicked out of school. This was a 7-year-old boy. And they were like, the school says, "Go and treat the epilepsy until he is totally seizure free. We cannot have him in our school." And I was ready to fight. I was like, "Let's go and fight." And the mother said, "Look, this is the 3rd school. We really don't know if we're ready for this long ball fight. So let's just go and do homeschooling." Homeschooling for hours, I was going to go and learn a trade. And this was a very intelligent person. And so those are the issues that are associated with epilepsy.
Let me just show you this question to the medical practitioners. Is epilepsy contagious?
Okay, yeah. I think 3 of us were outside together. 1, 2, 3. After
No.
1, 2, 3.
1,
2, 3.
No! Thank you, because I know why I asked this question. She grew up in a family of men. I won't tell you what. But they are many. And there is no issue with others. And to the glory of God, I think she has outgrown that issue. If the devil wanted to do a fast one, he has lost the battle. May the Lord be praised.
So what that thing does is not invasive anymore. What you do is you place some kind of electrode on the scalp in order to check the brain waves of the person you are trying to diagnose. And it has several functions. One of the functions is that for someone who had a seizure, okay, there are several seizures that look alike. And there are medications specific for some kind of seizure. Like for example, if a child is having absent seizure, you may go for epilepsy, right? But if a child is having focus seizure, you may go for carbamazepine or some other medications. And if you're using the wrong medication for different kinds of seizure, sometimes it will get worse. So what we do in essence is, whenever a patient comes to you and show a sign of having had that repeated episode that you people call epilepsy, we call it seizure. And I know most of my patients are always glad when you tell them you have seizure, not epilepsy. So we always tell them seizure, and they are always glad. But when you tell them epilepsy, they say over my dead body. My doctor says it's seizure, I have it. But normally what they are actually having is seizure, not epilepsy. Epilepsy is just a condition. So when they come and you diagnose them, you are able to do two things. One, to diagnose, to know whether their seizure is affecting some particular part of the brain or is affecting the whole part of the brain. So as a result of that, it aids the doctors in getting to choose the kind of medications you give to them. Then apart from that, it also aids in when the patient starts the medication, and there are durations for it. For most pediatrics, they will tell the patient to possibly use it for like the next 2 years, most especially when that patient has been confirmed to be epileptic. Okay, maybe for the next 2 years. Afterwards, they may tell the patient to do another EEG to possibly check if there is still an abnormality in the brain or not. Then afterwards, they can start to tailor the drugs now. And what does that mean? You start to reduce systematically, not just stop the medication abruptly. Okay, but for adult neurologists, they'll tell the patient to use it for like 3 years. So what I'm saying in essence is that it functions in, how would I call it, diagnostics. It also functions in selecting the kind of medications the patient use based on the diagnostics. Also, in tailoring the medications when you want to stop. Are you getting it? And it's also help you to rule out seizure in some patients, most especially like Dr. Banji's patient. Okay, some of our patients will come, you know, people even tag them as being a mental patient, not until they get to Yaba Psychiatric Hospital. And the doctor will tell them, no, this doesn't look like. Because a mental patient will not do this, will not do that. Perhaps let them carry out EEG. By the time they carry out an EEG and you saw some functional anomalies restricted to some areas or generally in the brain, then you know that this is actually a neurological case, not a psychiatric case. Then you can treat the patient with anti-seizure medications and that thing will stop. Okay? Instead of the patient going through the other routes. I hope you understand. So it also helps to rule out seizure in patients that have likely symptoms like those of mental, a patient with mental sickness.
Like we initially said, that perinatal asphyxia is one cause seizure and then eventually child developing epilepsy. So if there's any child that did not cry at birth, then some other causes, some children with jaundice at birth that was not treated properly can also have what we call cliniterals, which can also have seizure as part of his symptoms. So if those children, those babies are born like that, they need to be followed up in the hospital so we can pick early when there are signs and symptoms of seizure. So some in babies, they might not really come down with the tonic-clonic, the jerking and everything. Even slight smacking of the seizure in a child. So those are the things that we look at. And then even feeding difficulties. There are some that are not able to suck properly, can be a sign. So all of these can be signs of seizure, and it needs to be presented early to the hospital. Then you can now see exactly what it is, and then the medication to be started for that child. Also, and then as the child grows, the other things that you can look for are developmental milestones. When this child at 3 months is not holding the leg, is not sitting at 5 months, not rolling, not crawling, all of those things are things that we need to check. And then finally, when they now have the tonic-clonic jets of the symptoms, those are the things that can be checked. Thank you. Somebody has a question?
What do you do about the situation of parents or people who are scared of going to the hospital for obvious reasons of not hearing of bad news about the situation, or the fear of financial burden or treatment of such situation? Thank you.
I believe that coming to the hospital will help you a lot. Instead of having the fear, you are not sure what it is, you have a lot of stigma, people are not sure what it is. But if they know that when they come to the hospital, they can get the diagnosis and their medications. Like she said, I don't have people 2 years. Some children, you see, they want to start the medication in like months, they stop having the seizure, you just continue the medication for another 2 years, and they are fine. And you stop it, and they do not have the seizure anymore. So you would rather want to have that than just living with the fear of not knowing. The ignorance is even worse, I feel. That is worse than actually getting what diagnosis it is and the medication to be used. Yes, recently, the medications now are very expensive. They are now very expensive. So I know that also affects the continuation sometimes for some children. And what we have noticed is, for these medications, you have to take them. We even tell them to stick to particular timing because of the way it works. So if you are taking it at 7 a.m., you have to take it at 7 a.m. every day. And 7 p.m. is 12-hourly medication. So you take it at particular time every day, so as for you to be effective and for you to work properly. So what I feel is still better. That is where the support now comes in. They need support from government, from churches, from family members, because some of them are actually very expensive.
Going it back to everyone, okay? We are all going to be a mobilized grassroots army, okay? So what I'm saying in essence is that those women there in the market selling pepper, okay, will not understand what doctor is saying here. The first persons they see are those men selling a good that walks around the market and saying, I have a cure. Do your child have epilepsy? Look at it, 3 in 1. It causes epilepsy, it cures diabetes, it cures everything. They listen to them every now and then. So we are not going to sit right there in the hospital expecting these people to come to us. We are going to create awareness. And that is what she's doing. If you benefit from this today, then we need to either join an existing foundation and come into that, or create one where we get people who knows about these conditions, go out there with us to those markets to meet those women, just like people sold lies to them. We will go there to sow the gospel of truth to them about what epilepsy is and what it is not. We speak their language. We talk to them in the language they understand. We will not speak English to the woman selling pepper. Tell them Yoruba, then show them evidence. Here is Abila. And that is another thing I tell people who have epilepsy. Doctor just told us a story about someone, a child who used medication for about 2 years, and the child is okay. Are the parents willing to let their children be an example to show to others, have proof that medications work, and it has worked well? She knows I've been doing this thing for like how many years. She's even back of my organization. But what I'm saying in essence is that when you tell even people living with epilepsy to come out, let's march there, let people see you. Let them see your face as a face of advocacy, irrespective of even when you don't have it. I tell people, whoever has a brain can have seizure. Forget it. It's not just about the person that is having it today. It just depends on what causes yours. Anybody that has a brain can have seizure. Okay? So let's take the gospel to them. We don't need to wait for them to come to the hospital. Thank you. We would have some of these parasites escape into our brain, and when they get there, they affect the functions. It leads to seizures too. So, you said?
Hard drugs.
Yeah, it could also push to
Okay,
it.
so I can tell you that people who abuse alcohol excessively and suddenly have to stop will have seizures. In dealing with people who've had epilepsy and dealt with it, I think that's the number one problem that I have. So there are different kinds of bullying. There's the bullying of classmates who call them names, abusive and verbal bullying. But then there's also the bullying that happens in families. So for instance, this young girl that I said I treated, that I have been in her life for about 23 years, was not allowed to go to university by her family because they felt you can't cope. It's going to be difficult for you. So her younger sister got into University of Lagos, did masters, and she barely did secondary school. And that for me, it's a form of emotional abuse. Because the question I kept asking the family was, how do you know what our limits are when you don't even test it, right? So we said, let's deal with the ignorance. The child that is calling a classmate, oh, this person has warapa, this person has seizure, that is coming from ignorance. But families will now put a cap on people because you think seizures mean this person cannot become all they were designed for. That has to end because, yes, there are certain people that are going to have difficulties, I won't lie. But I'm like, look, test them. Let them even try. Let her do jam. Let her do post-UTM. If she fails 3 times, then we know, oh, this was not an option. But you do not just say because someone has seizures and the person is struggling, and then suddenly you say, oh, you're going to be a fashion designer for the rest of your life. What if that was not in their design? And I think it's something we have to do as a community. Because when you see someone with seizures that is not going to school and it's around your area and you know the person, ask questions. There are certain schools that have dealt with people with seizures so they know, they understand it, they can educate the children. For those kind of schools, it's not a problem for a child to come in with seizures and still continue. The schools that tell people to leave because of seizures, those schools need to be talked to, and we actually can report them to the Ministry of Social Welfare, because that's discrimination and it's illegal under Nigerian law.
Most of the time, we see a lot of things whereby people put spoons, they want to put fingers in the mouth, they don't want the teeth to clench together, and all of those things. They are not necessary. So, what should you do? Clear the area, just let the child or anybody that is having a seizure lie on the left side, and that is to prevent aspiration, so they don't aspirate their saliva and all of that. Let them lie on the side and then watch. And you will see that so most of the time the seizure stops on its own. But if at any point you now say, okay, you have timed it's about 5 minutes going into more than 5 minutes, then you take the child to the hospital. But all those putting palm oil I've seen, and those are the things that actually complicate the matter. By the time they are now getting to the hospital, we have aspiration, and that is what we will now start managing instead of managing just the seizure, which would have even stopped on its own. So when you have a child that is having seizure, please educate people. They don't need to put palm oil, they don't need to put onions. You see people putting onions and then coming with conjunctivitis, a lot of redness in the eye and all of those things. So what you need to do is just clear the area, put the child on the left side and allow it, watch the time, and if it's going beyond time, take the child to the hospital.
There are a lot of things people think about epilepsy that is not. But for what she has said, I just want to give us a clue. Whenever someone has epilepsy, which part of the body is affected? Everybody? So now we're going to use acronyms BRAIN to actually know what to do and how to assist whoever has a seizure. Okay? The first one is B, right? You have to be calm. Okay? You don't need to be afraid or you don't need to run away. The other one is what? How? You remove all dangerous objects. You remove anything that is sharp in the surrounding, okay, that could injure the person while having the seizure. Okay, that's the best you can do for the person. You can't stop it, you can't hold the person, but anything that could injure him or her, you remove it. Then the third one is A, always time the seizure. Just like she said, when it's more than 5 minutes or more, you need to call for an emergency and possibly take the patient to the hospital. Hi, in case the person falls down and is jacking, okay, what you do is, just like you said, you place the patient on the side, okay? Another thing you could do, because some patients will hit their heads on the floor, you could get whether a cushion or a pillow or something. If you are a man and you're outside, you saw a lady having it, and you have more than one shirt, there's nothing wrong with removing your shirt and possibly putting it under the head of the patient. So when the patient hits his or her head on the floor, the patient is hitting the head on your clothes and not on the bare floor. You want to reduce the injury to barest minimum. And I, okay, that's I. Then N, never. Everything she talks about never comes under what? Under N. Then S is the other one. You know, making sure the person gets make sure exactly the care as soon as possible care for the patient so that the doctor can take care. This is actually some of the things we can do whenever someone has a seizure. Okay, thank you.
When you isolate that child, you kill that child systematically, you wouldn't know that you are killing such child. You isolate them because of traditional belief or one thing or the other. Give them the necessary support, and definitely this idea of trying to guide and see that they don't injure themselves, cause more harm to their body, stands outrightly good for such a person. And remember, I will now talk as a Christian on my own part. Always pass your problems to God. You don't fight all battles by yourself. Let us just agree on one thing, that the best approach to such issue is do your best, and God will do the rest.